Welcome to today's Explainer. You know, we're doing something really cool, and honestly, totally unique today. We're going to give your life a holistic checkup. But we're not just throwing around vague metaphors here. We're actually going to use the exact, literal steps of a clinical respiratory assessment, the exact kind a nursing student would perform in a hospital to evaluate our personal boundaries, our mental health, and our everyday peace. So, are you ready to get your vitals checked? Let's dive in.
Here's the game plan for our checkup today. First, prep and vital signs. Then, Phase 3, visual inspection. Next up, Phase 4, palpating pressure. After that, Phase 5, deep auscultation. And we'll wrap it all up with Phase 6, documenting boundaries.
All right, let's jump right into Section 1, Prep and Vital Signs. It's time to establish our baseline. Picture this. You're a nursing student walking into a patient's room. You simulate washing your hands, and you use therapeutic communication right off the bat. You say, "Hi, how are you doing today? My name's Alex, and I'll be your student nurse. Can you please verify your name and date of birth for me?" Once he confirms he's Mr. Cruz, you explain the whole 15 to 20-minute process. You let him know you'll be taking his vital signs, looking at his skin and nails for circulation, and asking crucial baseline questions like, "Did you experience any falls this past few weeks?" But here is the absolute key to this clinical script. You are setting firm boundaries right from the start. If the patient asks for non-nursing favors, nope. Your time is defined, your role is crystal clear. So if we pivot this idea of baseline health over to our own financial vitals, things get really interesting. There's this fascinating study of Philippine Coast Guard personnel looking at economic empowerment, and researchers found these folks had a very high composite mean score of 3.31 in debt management, meaning they proactively minimize their debt and really understand their financial obligations. And guess what? This lined up perfectly with another very high score, 3.33 in job satisfaction. The takeaway is pretty hard to ignore, right? Healthy financial vitals literally lead to high morale and fulfillment. If your financial baseline is shaky, your overall life vitals are going to drop right along with it.
Moving on to Section 2, Phase 3, visual inspection. Let's check on that real health.
When a nurse visually inspects our patient, Mr. Cruz, they're looking for genuine physical signs of health. They want to see that he's neat, clean, and well-groomed, that his posture is upright and relaxed, and he isn't using extra accessory muscles just to help him breathe. They're checking for lips that are pink, smooth and moist with zero signs of cyanosis. They want pink nail beds with no clubbing and a capillary refill of less than 2 seconds. And for the chest shape, an anterior-posterior diameter of a 1:2 ratio is exactly what we want to see. Now, contrast that actual clinical reality with the highly edited, completely unnatural inspections we subject ourselves to online every single day. The beauty industry pushes these incredibly toxic social media trends, creating this intense pressure to pump Botox and fillers into perfectly healthy bodies, all just to meet some synthetic, fleeting standard.
And the emotional toll of all that pressure? It's huge. Just look at this quote from a writer named Melody Jacob, who was reviewing a book called The Price of Pretty. In the comments section of her blog, you literally see readers actively rejecting these plastic surgery trends. One reader, Anna Hudica, pointed out how every cosmetic fad just comes and goes. Another reader, Carlos, hit the nail on the head, saying the body should be loved naturally, without caking on makeup to mask who you really are, or as he brilliantly called it, max-factorizing yourself. Melody points out that underneath all these procedures is just an unspoken fear, a fear of aging naturally, and a fear of not fitting in. A healthy visual inspection should celebrate your natural, unedited self, not dissect it looking for flaws.
Next up is Section 3, Phase 4, palpating pressure. It's time to find the tenderness.
So, the clinical pro tip for palpation is to work from head to toe so you don't miss a single spot. You literally press on the patient's chest and ask, "Let me know if you feel any soreness. I don't feel any lumps or crunchy sensations, which we actually call crepitus. Any tenderness? No? Great." Now, take a second and think about that question. If you were to palpate your own social circle right now, working head to toe through your contacts, where do you feel that crepitus? Where is the toxic pressure? Where's the tenderness in your own relationships? We're actually seeing this exact kind of boundary setting happening all over platforms like Lemon8. Take a user named Ash Blips, for example. She posted about intentionally stepping into her protecting my peace era. Basically, by palpating her relationships, she found the tenderness, specifically a gaslighting situationship and a controlling, belittling person in her life. Her prescribed treatment for that?
Cut them off, leave them on read. When a relationship is causing you emotional distress and distorting your reality, taking a massive step back and reclaiming your energy is honestly the healthiest thing you can do.
If you aren't quite sure where that tenderness is in your own life, keep an eye out for these specific red flags of an imbalanced dynamic. Are you always the only one initiating communication? Do they pretend to be super busy but magically find time for everyone else? Are you waiting hours or even days for a single reply while feeling anxious the entire time? Look, continuing to chase someone who clearly undervalues you is just emotional exhaustion. And leaving someone on read, it isn't necessarily rude. It's a highly valid, incredibly healthy tool to assert your boundaries and protect your own time.
All right, moving into Section 4, Phase 5, Deep Auscultation. Let's listen to those inner obligations. In a standard respiratory assessment, auscultation means grabbing a stethoscope and listening to exactly 16 spots, 6 anterior, 2 lateral, and 8 posterior. The nurse tells the patient to take deep breaths in and out through the mouth, giving a quick warning: if you get lightheaded, just let me know. What you're listening for are clear vesicular breath sounds with no wheezing or crackles. But what happens when we apply a stethoscope to our own lives? What are we actually hearing? For a lot of people, taking a really deep look at their inner cultural obligations leaves them feeling completely lightheaded and totally overwhelmed.
A perfect example of this is a deeply ingrained Filipino cultural concept called utang na loob, which translates to a debt of one's inner self, or a debt of gratitude. The phrase walang utang na loob is this incredibly heavy, negative label used to describe someone who is seen as ungrateful or who refuses to honor that debt. In this culture, children are often born into relationships built on obligation, carrying this inherent expectation that they'll provide for their parents in old age simply because they owe them their lives and their education.
And the fear of being hit with that ungrateful label, it drives massive, life-altering decisions. It can totally dictate whether a student chooses a college degree they're actually passionate about or one that just fulfills their parents' wishes. It dictates how financial loans are handled within families, and it practically demands the reciprocation of emotional support at all costs, unconditionally honoring elder obligations. This is exactly why deep auscultation is so absolutely vital for us. You have to listen closely to your own life to figure out if these deep-rooted obligations are actually healthy and supportive, or if they're literally suffocating your ability to breathe freely.
And that brings us to Section 5, Phase 6, Documenting Boundaries. This is the ultimate self-care.
Let's bring it back to Mr. Cruz for a second. The student nurse finishes up the exam with a very clear, highly professional closing script. They say, everything sounds wonderful today, your lungs are clear in all fields, your respiratory rate is 16 breaths per minute, and your oxygen saturation is 98% on room air. Do you have any questions for me? When the patient says no, you reply, you're very welcome. I'll go ahead and document these findings. Thank you for your time. It's a precise, formal wrap-up that gets everything on the record.
And just like that nurse documents the physical findings, we need to formally document our life findings. By using tools like the ones from Mental Health America, we can actively detox our life. We do this by physically writing down the toxic influences, people, or behaviors that we just need to stop. We list out the personal values we want to protect, like our time and our mental health, and we literally practice the scripts we're going to use to defend them. You really have to document your boundaries to make them real. But to actually enforce these newly documented boundaries, you're going to need systems. There's another great insight from Lemonade highlighting quiet habits that will transform your life. We're talking about things like protecting your first 4 hours of the day just for your own creative flow, or operating from structured systems rather than just waiting around for the right mood or motivation, automating small tasks every week, and shifting your mindset from I have to do this to I get to do this, ending the day with gratitude. Look, real transformation isn't always some massive, loud breakthrough. More often than not, it's built in total silence, through quiet, consistent habits that enforce your peace.
Well, your holistic checkup is now officially complete. We've checked the vitals, we inspected the stanners, we palpated those toxic relationships, we listened to the cultural obligations, and we documented the results. So my final question to you is this. Taking these clinical assessment skills out into your everyday life, where do you need to draw your next boundary? Thank you so much for joining me for this explainer, and I highly encourage you to get out there and vigorously protect your peace today. Catch you next time.